Greetings and welcome to the Childbirth and Survivors presentation. My name is Ed. This is the table of contents. This is my bio. The source that I will be using for this presentation is the book When Survivors Give Birth by Simkin and Kloss. Child Sexual Abuse, which I will refer as CSA, and pregnancy. So during pregnancy, the past, present, and future as it pertains to CSA is in thoughts. CSA and pregnancy. So treatment, self-worth, and re-traumatization. Self-worth may be questioned by someone who had experienced CSA, and they can be re-traumatized by the pregnancy, or they may be re-traumatized by the pregnancy. Becoming pregnant. So becoming pregnant can bring up, or maybe bring about anxieties as far as like the pregnancy, and also the safety of the child. Becoming pregnant. So pregnancy discomforts and severe anxiety can be or may be elevated for those who had experienced CSA. Challenges in pregnancy. Unresolved CSA and pregnancy complications. If someone who is pregnant had experienced CSA, that experience is unresolved, it can or may add to pregnancy complications. Fears, phobias, and anxiety, emotional or psychological distress. So the fears, phobias, and anxiety of the pregnancy based on past CSA may bring forth emotional or psychological distress. Fears, phobias, and anxiety, invasive procedures, so vaginal exams and blood draws. So pregnant folks who had experienced CSA may view certain procedures, which may be normal procedures, as invasive. And they could be invasive, they could not be invasive, such as vaginal exams. And then maybe, that might add to fears, phobias, and anxiety, as well as blood draws, if blood was involved with the past CSA experience. Choice. So the pregnant person may choose to avoid medical care except in emergency situations. Choice. The pregnant person who had experienced CSA may choose midwifery services and or out-of-hospital option for labor and delivery. CSA survivor and childbirth. Memories and emotions. So childbirth for the pregnant person who had experienced CSA may bring about memories of the CSA and different emotions that may have been connected with the CSA. Challenges. So there may be challenges with labor and delivery for those who may have experienced CSA. Triggers. Normal events and interventions may have a double or hidden meaning for those who may have experienced CSA. Triggers. Unexpected touch may bring about tension, fear, memories, pain, helplessness. They may feel helpless, right? They may feel invaded, and they may feel unsafe. So this is something to keep in mind when um, when a person is in labor and delivery. Triggers, stress. So words and actions may cause stress to the person who may have experienced CSA, and they may interpret the words and action in a certain way and react in a certain way to those words and actions. Triggers. So the body may remember. So if the person who had experienced CSA does not remember or totally remember the experience, the body may remember and may react um, during pregnancy, labor and delivery. Control. Okay, support body and behavioral reactions. So based on the support that may be present um, for the pregnant person, what their body does automatically, and maybe their behavioral reactions to the pregnancy and labor and delivery, they may feel a lack of control. Postpartum, physical, social, sexual, mental, and emotional. So people who may have had experienced CSA um, may experience challenges physically, socially, sexually, mentally, and emotionally postpartum. During the postpartum, um, the now mom may project the stress towards the baby and view or perceive the baby as vulnerable and unsafe. PTSD, so unresolved trauma based on CSA may result in PTSD throughout the perinatal experience. Breastfeeding, so sensations and memories. So the sensations of breastfeeding may bring about memories of past CSA. Postpartum mood disorders, greater risk. So people who were pregnant and had baby may have greater risk for postpartum mood disorders if they experience CSA. Next steps. Next step is to talk to the doctor and or gynecologist. It could be to enroll in childbirth education classes to obtain more information about the perinatal experience. Could be to consult with a doula who provides services educationally, emotionally, and physically. It could be to um, speak to a lactation consultant who supports with breastfeeding challenges. Could be to um, to go and experience a perinatal massage with a perinatal massage therapist. Could be self-help, and that could be reading a book. It could be doing yoga or perinatal yoga. It could be seeking out birth counseling, um, where this could be an opportunity to speak more about birth and feelings about the prenatal experience. It could be to talk to psychotherapists and receive psychotherapy, which may be more intensive in the counseling, and may be done possibly with the counseling, the birth counseling. In conclusion, the effects of abuse do not end when the abusive acts end. So this is in the book source that I mentioned at the beginning of the presentation. Thank you for your time. I can be reached by email at edlatortue@woosadoula.com. That's EDLATORTUE at WOOSADOULA.com. You can you can see me on Facebook and YouTube um at Woosa Doula. And also you can follow me on Instagram at Woosa_Doula.